I've seen the rise in this one painkiller being prescribed, and here's why I'm not the biggest fan of it. I'm Dr. A GP based in the UK, and with the rise in chronic pain syndromes such as fibromyalgia, the use of painkillers has gone up. But this one painkiller seems to be prescribed very, very often, and I've seen a rise in it, and that medication is gabapentin. The crazy thing about gabapentin is the manufacturer of the drug actually got sued a while ago because they said it had a bunch of indications when it didn't. Today it's prescribed so often for so many conditions in which it is effective, but I want to talk specifically about pain. Now, I've said this in the previous video, but the evidence for use of gabapentin in neuropathic pain is weak. There are 2 indications in pain specifically for diabetic neuropathy or post-shingles neuropathy where it has been shown to be effective. Now, considering that and my own personal experience of it, I try to avoid prescribing gabapentin whenever I can because the whole purpose of a painkiller is to improve your pain and make you function better. But I find with gabapentin, when patients start it, it doesn't really help their pain. And if it does, they have to use such a high dose, they just end up being drowsy and they're functioning less than they were before they started the gabapentin. When you consider gabapentin can be very addictive and is very hard to come off and can have severe withdrawal symptoms, I really am not a fan of it. However, I will consider prescribing it in patients who have tried everything else and nothing's worked. But it'll be a very, very short course, and the first sign of any side effects or it's not working, I wean them off almost instantly. But like every medication, everyone is different. Some people may have side effects, some people may not. Some people may have some benefit, some people might not. This is my personal experience with gabapentin, using evidence and what I've seen the results been with people who've been prescribed it. So if you're on gabapentin, please don't suddenly stop, but have a chat with your doctor about coming off it if you want to, and please inform them of any side effects.